HAM, brain abscess, overview, causes, symptoms, diagnosis, and treatment. A brain abscess is a serious life-threatening condition characterized by a localized collection of pus, immune cells, and other materials inside the brain tissue resulting from an infection. It can occur when bacteria, fungi, or other pathogens invade the brain, typically due to a predisposing condition or trauma. Causes and risk factors. 1. Pathways of infection. Hematogenous spread. Infection spreads through the bloodstream from a distant site, e.g., endocarditis, lung infections. Direct spread. Infection spreads from nearby structures, such as sinusitis, otitis media or mastoiditis, dental infections, trauma or surgery. Direct introduction of pathogens due to skull fractures, penetrating head injuries, or neurosurgical procedures. 2. Common pathogens. Bacteria. Streptococcus species, Staphylococcus aureus, Enterobacteria C, Pseudomonas aeruginosa, anaerobes, Bacteroides species, fungi, Aspergillus, Candida, parasites, Toxoplasma gondii in immunocompromised patients. 3. Risk factors. Immunocompromised state, e.g., HIV, AIDS, diabetes, cancer, or immunosuppressive therapy. Congenital heart diseases with right-to-left shunts, chronic infections, e.g., pulmonary infections, endocarditis. Symptoms of a brain abscess can vary based on its size, location, and the extent of swelling. Common signs include 1. General symptoms. Headache, most common, usually severe and persistent, fever and chills, nausea and vomiting. 2. Neurological symptoms. Altered mental status, e.g., confusion, drowsiness, seizures, focal neurological deficits, e.g., weakness, speech difficulties, signs of increased intracranial pressure, e.g., papilledema, drowsiness. 3 other symptoms: visual disturbances, neck stiffness if meningitis coexists. Diagnosis. Diagnosing a brain abscess involves a combination of clinical evaluation and imaging studies. 1. Imaging. CT scan with contrast typically reveals a ring-enhancing lesion with surrounding edema. MRI with contrast, more sensitive, providing detailed visualization of abscess location and structure. 2. Laboratory tests, blood cultures to identify systemic infection, complete blood count CBC showing leukocytosis, inflammatory markers, e.g., ESR, CRP. 3. Definitive diagnosis, aspiration biopsy, stereotactic needle aspiration of the abscess for microbiological analysis to identify the causative organism. 4. Additional tests, lumbar puncture, rarely done due to the risk of herniation, contraindicated in raised intracranial pressure. Treatment. Management of a brain abscess involves a combination of medical therapy, surgical intervention, and supportive care. 1. Medical management, antibiotics, empiric therapy based on suspected pathogen, e.g., ceftriaxone plus metronidazole, vancomycin if MRSA is suspected, adjusted according to culture and sensitivity results. Antifungal therapy for fungal infections, corticosteroids to reduce cerebral edema and intracranial pressure, used cautiously. 2. Surgical management, aspiration or drainage, stereotactic aspiration or craniotomy to relieve pressure and obtain a sample for diagnosis. Excision, reserved for large, multiloculated abscesses or cases not responding to other treatments. 3. Supportive care, management of increased intracranial pressure, e.g., osmotic therapy with mannitol. Seizure prophylaxis with antiepileptic drugs. Complications, persistent neurological deficits, seizures, hydrocephalus, meningitis, brain herniation, a life-threatening emergency. Prognosis. Prognosis depends on early diagnosis and effective treatment. With timely intervention, mortality rates have significantly decreased, ranging between 5 to 15%. Neurological sequelae can occur in 20 to 30% of survivors. Prevention. Early treatment of infections, e.g., sinusitis, otitis media. Vaccinations, e.g., pneumococcal and meningococcal vaccines. Proper management of immunosuppressive conditions. Avoidance of penetrating head injuries or infections. In conclusion, a brain abscess is a medical emergency that requires a multidisciplinary approach involving neurologists, infectious disease specialists, and neurosurgeons. Early intervention improves outcomes significantly.